Welcome back. Right now, there are 7 million people here in the United States living with Alzheimer's disease, and 80,000 of them are here in our state. They're here in Connecticut. That's according to a new report from the Alzheimer's Association. This year, there is a big focus on caregiver stress, and families are really struggling. So joining us now to talk more about it is Kristen Cusato, Director of Communications of the Alzheimer's Association here in Connecticut. Thanks for being back with us here on the show.
Thank you for
Always
having
great to
us.
have you
Appreciate
here.
it.
Now, we know that people living with Alzheimer's are dealing with all kinds of stress, but their caregivers are as well. What are we learning about this new report? What's the new data?
Right. Well, caregiving, as you know, and so many people know, is exhausting mentally and physically and financially.
Right.
We know about 30% of the caregivers in Connecticut are depressed, but this new report says 7 out of 10 are really stressed out navigating the dementia care system. So what does that mean? Going to the right doctor first, the right doctor next, getting those appointments, getting insurance coverage, making sure they've got the right care plan. It's a lot.
Yeah, I can only imagine. It's so difficult in general sometimes when you're dealing with the healthcare system, but then specifically. And a lot of times this is a family member, so that makes it even harder because there's a lot of stress, just getting the logistics of it down, but then there's the emotional toll, the emotional pull.
Right, and then when they can't do this, right, it's very, very stressful to be able to navigate it. So what does that mean? That means they could miss these really important windows of opportunity. This is kind of a time is of the essence, especially early on. We want everyone to get diagnosed early for many reasons, maybe to get involved in a clinical trial, but as I've come on and talked to you, there's a new treatment out there that actually changes the course of the disease for those in the early stages. So if you don't get diagnosed within that window and go through all the tests, you may not be able to qualify for the medication. That's Leqembi, and it's rolling out across the state. Also, people may not be able to navigate the care transitions or be in and out of the hospital. And then if the caregiver doesn't take care of themselves, what happens?
Right.
They're not there for their person. So that's a lot. You're right.
Yeah, their self-care is so important. So how can they try and reduce that stress?
Right. There's a lot of things that we can do as far as people can reach out, right? Reach out to us as the Alzheimer's Association, which is our 24/7 helpline, which we always talk about. It's 800-272-3900. Caregiver support groups, care consultations, but also other agencies across the state, other organizations need to reach out and help these folks. Plan that dementia care coordination. Make sure that they know how to apply for Social Security disability insurance, which is something that people with younger onset have to apply for sometimes once or twice. And then when we look at caregivers and when we want to support them, we always say, hey, let's just show up at their house. Bring them a hot meal. Say, I will be there for you so that you can go to the doctors because you haven't been going to the doctors all year long because you've been so worried.
Right.
You really need to support those caregivers in all aspects.
Right. Now, while you're here, talk a little bit, you were talking about the window to find out about treatments. Talk a little bit about that as far as what people should be aware of.
Yeah, I just think it's really important for dementia education all around to know what are the signs you're looking for. And when you've got those signs, take them to a healthcare professional, not just you personally, but your care partner. Both need to be there. And then you need to find, is there, are you getting lost coming home from a grocery store that you've gone to for 15 years? Are you not able to retrace your steps? Do you have your keys in your hand, but you don't know what they do?
Where you were going.
Those kinds of things. And take them to a doctor to see if it's something else or if it's a memory concern, and then you go to a neurologist. But again, navigating what to do when, it's hard. And we say this whole entire thing takes a village, but we all need to step up across the state and really support our people. More and more people are being diagnosed every day.
Yeah. There's a lot to be aware of. And so the best place, again, you just said the Alzheimer's Association.
Yeah, give us a call, 24/7 helpline, 800-272-3900. Any calls about any information about Alzheimer's or dementia, go to alz.org and really reach out, and really be there for your people who are going through this because we don't want people to go through this alone. That's our whole thing.
Right. Right, you want them to have the support because the support is out there.
It is.
All right. Kristen, thanks so much.
Thanks,
Always
Erica.
great to have you here on the show.
Appreciate it.